In my many years of practice, I have seen many children brought to the clinic because of convulsions. Some parents become very afraid when it happens, and sometimes they do the wrong things because they don't even understand what convulsion is. So today, I want to educate mothers and caregivers about convulsions, what it means, why it happens, and what you should do when it happens. Welcome to Smart Living with Nozday. In this place, what we'll do is to educate mothers, how to take care of their children, and then making them have basic knowledge, first aid. Whenever anything happens, especially in the nights, what they can do immediately to avert complication or even help to buy time before they get to the hospital. So if it is a place where you know that you will always come and gain information, why not hit on the subscribe button, like this video, share to every mothers around you, and then on your notification bell. First thing first, what is convulsion? Convulsion is a sudden shaking of the body that a child cannot control. It's not the place of that child, to stop shaking or to stop jerking. When a child is convulsing, you may see the body shaking, you may see it jerking, the eyes rolling up, the child becomes stiff, the child losing consciousness, foaming from the mouth even sometimes happened. Convulsion can last a few seconds or several minutes. It can be very frightening for parents, but it is important to stay calm and then know what to do, because knowing what to do is going to help you a lot. Now, why do convulsions happen in children? That is the first question. There are several reasons why a child may convulse, and the common one is high fever. When a child has a very high temperature, the brain may react and then cause convulsion. This is called febrile convulsion. Other possible causes include severe infection, malaria, meningitis, low blood sugar, head injury, and epilepsy. This is why it is important to always bring the child to the hospital immediately after convulsion because of the negative effect on the child. So what are the signs, that shows that this child is about to convulse? Yeah, they usually give you symptoms that this child is about to convulse, or this person is about to convulse. Sometimes a child may show some signs before convulsion starts. These signs may include very high fever. You will feel the child, you check the child. Most of the time we use our palm, back of the palm, to feel if the child is really hot or not. So when you have checked and noticed that this child is having very high temperature or high fever, you should suspect convulsion is about to happen. Then the child becoming weak, that is another sign. Then the child not responding well. The unusual crying, you just see the baby crying unusually, trying to stop the cry is not working, body becomes stiff. So those are the signs that shows that this child wants to convulse. When you notice these signs, seek medical help immediately. Borrow leg and go to the hospital. Now, what should you do when a child is convulsing? And that is where this lecture comes in, to be able to give you some basic knowledge about these common illnesses that happened, to our children. And this emergency mostly happened at nights. So when you have this basic knowledge, and when it happens, you know how to handle it. So this is very important for many mothers to know. If a child is convulsing, learn as much as possible to stay calm. Do not panic, because when you panic, you get confused, then doing the wrong thing. They lay the child on the floor or bed on the side. The reason why that child must be, lay side is because during that process of convulsion, they can be choked with spit that is coming out from the mouth, and that is another problem. So when you see a child or somebody that is convulsing and is at home, try as much as possible to lay that person on the side, so that even if spit is coming, it can, come out on its own without choking the person. So another thing you could do is to remove tight clothes around the neck, move sharp objects away from the child, because as the child is jerking or shaking, it can use those sharp objects to harm itself. You understand? They allow the convulsion to stop on its own. Do not try to stop it. it's the one that starts and it will also end. It's only, maybe it can just last for like some I know it can last from like some seconds to minutes. It is turned. Then rush the child to the hospital immediately. Do not waste time. Rush that child to the hospital immediately.